Welcome to today's important health guide. In this video, we'll discuss the signs, symptoms, and risk factors of colon cancer, a disease that often develops quietly but can be treated successfully if caught early. Let's get started. Colon cancer, also known as colorectal cancer, begins in the large intestine or rectum. It's the third most common cancer worldwide, and early detection plays a crucial role in improving survival rates. Let's first talk about the signs and symptoms you should be aware of. One of the earliest warning signs is a change in bowel habits. This could mean diarrhea, constipation, or a change in the consistency or shape of your stool, lasting for more than a few days. Rectal bleeding is another red flag. You might notice bright red blood or darker blood mixed with the stool. Some people notice blood in the stool that isn't obvious to the eye but can be picked up by laboratory tests. This is why routine screening is so important, especially after the age of 45. Another symptom is persistent abdominal discomfort, including cramps, gas, or pain that doesn't go away. You might also experience a feeling that the bowel doesn't empty completely even after a normal bowel movement. Weakness and fatigue can occur because colon cancer may cause slow, chronic blood loss, leading to anemia. Unexplained weight loss without changes in your diet or exercise habits should also raise concern. In more advanced cases, colon cancer can lead to nausea or vomiting, especially if a tumor is causing a blockage in the intestine. Remember, in the early stages, colon cancer might cause no symptoms at all. That's why regular screening is crucial, even if you feel perfectly healthy. Now, let's talk about the risk factors that can increase the chances of developing colon cancer. Age is a major factor. The risk increases significantly after the age of 50. However, recent trends show that more younger adults are being diagnosed, which has led experts to recommend starting screening as early as age 45. Family history matters too. If you have a parent, sibling, or child who had colon cancer, your risk is higher, especially if they were diagnosed at a young age. Certain genetic conditions like familial adenomatous polyposis or Lynch syndrome also raise the risk. Personal history of inflammatory bowel diseases like Crohn's disease or ulcerative colitis can increase your chances as well. Diet plays a role. Eating a lot of red meat, processed meats, and low-fiber foods is linked to a higher risk. Lifestyle factors such as smoking, heavy alcohol use, obesity, and physical inactivity also contribute. Other risk factors include type 2 diabetes and African American ethnicity, both associated with higher rates of colon cancer. It's important to remember that having one or more of these risk factors does not mean you will definitely get colon cancer, but it does mean you should be extra vigilant about symptoms and screening. So, what can you do? Screening tests like a colonoscopy can detect colon cancer early, even before symptoms appear. Removing polyps before they turn cancerous can actually prevent the disease altogether. Eating a healthy diet rich in fruits, vegetables, and fiber, staying physically active, avoiding smoking, and limiting alcohol intake can all help reduce your risk. In short, awareness is key. Knowing the warning signs, understanding your personal risk, and committing to regular screenings can save lives, possibly even your own. Thanks for listening to today's important health message. Stay informed, stay proactive, and take care of your health. If you found this guide helpful, be sure to like, comment, and subscribe for more vital health tips. See you in the next one.